Greetings, greetings, and thank you all out there in virtual platform land. This is Sister Dana, and I have an awesome presentation and guest to share with you on this Thursday evening. So I need you guys to like and share and like. We're going to go ahead and start calling some names as you start joining. So right now, I can't see any names. I know we're live and we haven't done this in a minute on a Thursday. So as you come onto the platform, if you could drop your name in the chat, and we will go ahead and mention your name as we prepare to bring our guest forward to talk about a subject, healthy skin. Who doesn't want healthy skin? I know there's so many misconceptions out there. So that's why we have the experts that are going to join us and help us to get some facts going on. And then we can invite them to the stage and they can help you regarding the presentation. So it says that I have 8 people that right now are considering to join us. Now we have 9, but if you'll be so kind to put your name in the chat so we can formally welcome you, that would be great as our numbers continue to climb. So Leslie Ann Cooper, thank you, Leslie, for joining us. Leslie, can you like and share and like, so others out there can join us for this informative presentation on this evening? So we have a phenomenal speaker. Her name is Dr. McKinney, and I was afforded just a short opportunity to meet her in the bookstore. So I put the comments on the screen so I can see you as you're coming in. So Paris Love, thank you for taking the time out of your busy schedule to join us. And Dinah Bolton, thank you. You guys are in for a treat. And Lori Colburn, thank you for joining us on this evening. So as I was saying, it's summertime and it's like, do we do coverage? Do we do sunscreen? Do we not? How many times do we reapply? You're African American, you don't need sunscreen. And so I'm like, what? So this is the platform where we can get answers to our questions. So we're just going to hurry up and get started as a few more join us. We have my mother-in-law, Patsy Gordon. Thank you, Mom-in-law, for joining us. We have Faith Lane. Thank you for joining us. We have Josie Bird. Hey, Josie. Thank you all. Thank you. So what I'm asking is that you like it and that you share and invite others, because once I get off of the studio or leave the studio, it's going to be Dr. McKinney. She's going to join us. So I'm going to bring her to the platform as others are joining, and then we'll do a soft introduction, and then she'll start her presentation. Then there'll be a Q&A at the end. So we're asking that you drop your questions into the chat, and then I'll scroll back and we'll go over those questions at the end of the presentation. But I promise you, I peeked at it earlier, and it's information that you definitely want to know. Okay? So without further ado, I'm going to bring Dr. McKinney to the stage.
Hi, everybody.
And welcome. So tell us a little bit about yourself.
Yeah, so I'm Manisha Kanakarajan McKinney, but I go by Dr. McKinney because that's a lot easier than that whole name. I graduated from Wayne State Medical School in 2025, and I did my first year of residency in internal medicine, and I just completed that this past June. So now I'm in like a research year before further pursuing dermatology and dermatology residency. I'll have to like apply for that, and that will be coming up in the time to come in the next couple of cycles. And so I am currently a resident and like a doctor in training, but I have experience with dermatology and working with very well-trained and very experienced dermatologists since 2019. So I've learned a lot about the specialty in the field over the past like 7 years, and I love it. and I love talking about skin. And that is why I want to be a dermatologist, and I'm happy to be here to talk to you all. I also have a board certified dermatologist, Dr. Sierra Robinson, who will be jumping on during the question and answer portion to help me answer any questions that you all have so that we can make sure that you all get the most out of this presentation and get, all of your questions answered. So she will be jumping on later. She currently practices in Sarasota, Florida. She graduated from Henry Ford Dermatology just about a year ago. And so she is amazing. And yes, I'm excited.
Awesome. Without further ado, we're going to go ahead and get started with your presentation. So I'm going to pop it on the screen. And then again, I'm going to remove myself. And if you'd be so kind just to say next screen, then I'll advance the screen for you.
Sounds good. Alrighty. So I already introduced myself, so we'll be talking about the Healthy Skin, Healthy You. So this will be a dermatology talk. A bit of an overview of what we'll be discussing is the biggest question, what is dermatology? We'll start there and get a foundation of that. Then we'll go into some common and some not so common, but still very important skin conditions, especially for skin of color, that we'll be talking about. And then we'll go into some general, like everyday skincare, some things that you can do daily to prevent things like, some anti aging tricks and tips and tricks, and some, things for dark spots, things like that, and when to pursue cosmetic therapy, or when some cosmetic therapy options that are out there for people who have certain things like that. We'll talk about wrinkles, things that like that. And then we'll go into like some general takeaways and then resources at the very end. If you experience any of these skin conditions I'll be discussing, that you can look into, along with pursuing a dermatologist and finding some care that way. So next slide, please. Okay, so what is dermatology? So, dermatology is a branch of medicine that focuses on diagnosis, treatment, and prevention of diseases involving the hair, the skin, and the nails in both children and adults. So, dermatology has a few subspecialties. So, there's cosmetics, like I kind of discussed just a moment ago. There's something called Mohs. So, Mohs is a type of procedure where they slowly remove layers of the skin in attempt to remove like a skin cancer in various areas like the face and areas where like the skin is more thin or more fragile, and the structure of like your face and the area that they're operating in, they want to maintain the structure. So that's another thing. They look under a microscope at each layer of skin and slowly remove like skin cancers in that way to preserve as much skin as possible. And then, of course, there's pediatrics to focus on the kiddos. And then there's something called dermatopathology, where they are primarily looking at skin samples under a microscope to diagnose certain skin conditions. That a lot of dermatologists will take biopsies of the skin, send it into, a dermatopathologist. They'll take a look at it and be able to tell you what it is. And so dermatology treats a wide variety of diseases, including like hair loss, moles, skin cancer, acne, fine lines, things like that. They also perform minor procedures in the clinic. Like I said, one of them is biopsies. Another one they can do, of course, is the cosmetic procedures, are like more minor procedures. Sometimes they will do something called a wide local excision, where they remove skin cancers. They inject the scalp and various areas of the skin with like steroid to calm inflammation, things like that. So what is a dermatologist? So dermatologists are medically trained, board certified physicians that specialize in the diagnosis, treatment, and treatment of diseases involving the hair, skin, and the nails. So they go through 4 years of medical school, 3 years of dermatology residency, along with 1 year of internal medicine. And then they can sometimes pursue fellowships in the subspecialties I mentioned above for 1 to 2 years, sometimes longer. And so those are the people that specialize in dermatology. So finding a dermatologist, so one way that can be pursued is from a referral from your primary care doctor. If you have a certain condition that can be concerning, or even if you bring something to them that you would like a dermatologist to see you regarding, then they can give you a referral. There's something called the American Academy of Dermatology website, and you can go on there and click find a dermatologist. There's like a directory for the general population, and you can search for a dermatologist that way. of course, make sure your insurance coverage is available for your appointments, and then you can call their office sometimes and see if they're accepting new patients. Next slide, please. Okay, so as mentioned, some common and maybe not so common skin conditions. Some of these, this is an exhaustive list of some of the things that I wanted to mention, and some of these I will be also discussing later on in this presentation. So of course we know about acne. There's hair loss, aka alopecia. There's seborrheic dermatitis, which I will be discussing later on what that is. There's eczema. We know kind of what eczema is. It's an example of that would be this larger picture in to the left, where this is like the inside of the arm with some eczema on it. And then there's psoriasis, which you can see is in the top right of the screen. And sometimes those two conditions, if you kind of look at them briefly or quickly, sometimes they may look a little bit similar. These two are pretty, severe cases of both of them, so it's kind of difficult to confuse them. But sometimes, they can be confused on darker skin. Sometimes they can look similar. There's something called xerosis, which is just dry skin. Hyperpigmentation, a lot of us know about that. And then DPNs, or dermatosis papulosa nigra, is what, as you can see in this bottom left, this is Morgan Freeman. And we all know that he has, those very nice little dark black spots under his eyes. And those are called DPNs. So something new and fun fact that you can tell your friends. And then there's hidradenitis suppurativa, and there's which I will talk about that later. That is a very interesting and long word. And then there's vitiligo, and then we'll discuss skin cancer as well. So next slide, please. Okay, so alopecia. So I have some pictures of what I'll be discussing over here, just a couple of examples. So alopecia equals hair loss. So there are many types of alopecia. You have non-scarring and then versus scarring alopecia. So non-scarring alopecia means that, the follicle is not damaged, or there's not inflammation that's causing like permanent damage. So the hair follicle essentially is still intact, and hair regrowth may be possible in most cases. So for example, a type of non-scarring alopecia would be alopecia areata. It's a type of hair loss where the immune system can start attacking hair follicles in a particular area of your scalp, and it can cause like a smooth round patch in the scalp that, as stated, because it's non-scarring, a lot of the time can grow back. And it's not anything that is, life-threatening or anything like that. It usually happens in like the younger population, and then, there's not really always a reason why, and then the hair grows back. There's another one called traction alopecia, where hair loss occurs from repeated pulling by like tight braids, tight ponytails, extensions, something that's yanking on the hair and causing there to be hair, like damage to the hair. This can also result in permanent hair loss if there's, enough like repetitive like pulling, and, inflammation occurs in the area. But a lot of the time with change in hair practice, the hair can grow back. So in the top right photo that you see at the top, that's an example of traction alopecia. So for scarring alopecia, this refers to the type of hair loss where there's inflammation and then most of the time permanent damage of hair follicles, and that results in irreversible hair loss. So there's one that has this really long name that you see, which is centrifugal cicatricial alopecia. So usually you'll hear dermatologists or people say CCCA. It's a lot easier to say that than that name. And it can result in like a tinder. Sometimes people say their scalp feels itchy and like just discomfort in like this crown of the scalp. And that's where it begins right there. And you can see like hair thinning as well. And then it starts to spread from the crown usually. And you can see that here in this bottom right photo, and how it looks different from, the top photo, where there's just like the scalp looks very like inflamed. You can see some swelling and, just it's a bit different and looks more severe. This is, a more severe case of that. I tried to pick photos where you could really tell what was going on. But sometimes it doesn't always, if it's earlier on, won't always look this bad. So if you have like, some tenderness and itching and discomfort and then in the crown of your scalp, and then you look and you can see that there's thinning of the hair, then it would be, wise to possibly schedule an appointment with a dermatologist. And then there is discoid lupus alopecia. So it's a type of lupus that is isolated to the skin. And sometimes people lose hair from that as well. So there's inflammation in the area. It causes like discolored, usually like it's called hypopigmented, so light patches or light spots in the scalp that are tender, and then it results in complete hair loss as well. Next slide, please. All right, another one is seborrheic dermatitis. This is also very common. So it's a common inflammatory condition that causes itching, flaking, redness in the oily areas of the body, especially like the scalp, the eyebrows, nasolabial folds, which is the area that's right in here, and the beard, the chest. And it's caused by essentially there's a fungus that we all grow on our scalp in the oily areas of our body, but some people have an environment in those areas that just happens to grow that fungus a little bit better. And so you can see in this top right photo, this is an example of what that can look like in the scalp. And it's very itchy. It causes redness, burning, irritation when you put certain products in your hair, tenderness, redness, all of those things. And this bottom photo is just a close-up with like a microscope looking at, the dandruff and the oil. You can see that greasy, oily, like flakiness in the scalp. So treatment for this, it's not anything that, like I said, it's very common. It's not anything that's too life-threatening or serious. Most of the time, anti-dandruff shampoos, whether it's prescribed or over the counter, can work for this. Sometimes you give antifungal creams. If it's really badly inflamed and irritated, sometimes you can have a short course of topical steroid on the scalp. There are different ways to receive like a steroid on the scalp. So they have like an oil-based form if you're wearing braids, or like a foam, things like that to accommodate different hairstyles as well. And then the main thing for this is regular scalp cleansing with like a prescribed shampoo or just an anti-dandruff shampoo is important for treatment. So I know, with a lot of the hairstyles that we wear as far as like braids, I have braids in now and things like that, it can be difficult if you have your hair straight for a while, or if you wear wigs. Sometimes it can be difficult to shampoo your hair once a week, which is at least the minimum amount of time that you should be washing your scalp if you have this condition. I actually washed these braids with them in my scalp because I have a mild case of this myself. And so there are ways kind of around it. I've seen someone who had braids who she put like a wig cap on her head, and then she washed her braids through the wig cap. It works better for smaller braids, I guess. But of course, yeah, it just kind of depends. But that's the most important thing as far as this condition, is to make sure that you're cleansing your scalp as much as possible, and kind of asking, your dermatologist ways to get around that so we can keep this at bay. Next slide, please. All right, so hyperpigmentation. So it's darkening of the skin caused by melanosomes, which are the cells in the body that create melanin, responding to some sort of what I call like a stimulus. So for one, there's post-inflammatory hyperpigmentation. So it's a result of like acne, cuts, burns, or irritation causing inflammation and damage to the skin, which leads to skin darkening. Then you have something called melasma or dyschromia, which is a result of changes in hormones, for example, pregnancy or repeated sunlight exposure over a period of time that can cause skin darkening. So on the top photo, you can see post-inflammatory hyperpigmentation from likely like acne. You can see the small dots resulting from the inflammation and then resolving and then leaving a dark spot in that area. And then the bottom photo, you can see what looks like maybe like melasma, dyschromia, where likely from, repeated sun exposure, not using sunscreen, possibly. She also has, those little dark dots, which look like they could be DPNs as well, which can be a result of like sun exposure too. So, yes, so those are the two photos of those conditions. And then also like things like friction, which can be irritating, certain medications and things like that can also cause hyperpigmentation in various areas of your body. So treatment is usually treating the underlying condition. So if you have post-inflammatory hyperpigmentation from acne, treating the acne will help resolve that over time. It does take a long time for dark spots from, post-inflammatory hyperpigmentation to go away. But yes, treating the underlying condition, if there is one, is the first thing that you would want to do. And then there are ways to brighten dark spots and brightening agents. So there's azelaic acids, there's hydroquinone. There are other things too that are, becoming more popular. I know there's something like tranexamic acid and things like that. There's a newer one that's coming out too, and some newer formulations of brightening agents that can be prescribed. But usually, from my experience watching other dermatologists prescribe those medications, they always make sure to preempt that it will take a while for these dark spots to go away, even with this medication. So then there's that, and you can apply that topically over some time. And then, of course, sunscreen. Sunscreen helps to prevent those dark spots from getting darker. So your skin, when it hits the sun, it gets tan. Those dark spots also get tan, so then they get a little bit darker. So it's best to apply sunscreen to these areas to help them lighten, I guess, a little faster, or actually improve over time. Next slide, please. Okay, so I mentioned this word a little bit earlier. So we have something called hidradenitis suppurativa. So as you can see in these photos, it's can be a rather debilitating skin condition for those who experience it. So it's a chronic inflammatory condition that causes painful, recurring lumps beneath the skin. Is most commonly in the skin folds. So areas like here you can see in the armpits. There's like in the groin. It can be between the buttocks, underneath the breasts. And the symptoms include like painful bumps or abscesses, drainage and odor. It can lead to scarring. It can lead to tunnels beneath the skin. The mechanism of how this disease happened is still being investigated, but likely it seems to be centered around hair follicles and there being an inflammatory process that leads to this developing. So I know that sometimes there's also another name for it that I've seen that's like called acne inversa, since it's centered around, like hair follicles and like these bumps and boils forming. But it's not acne. It's, this painful bumps and abscesses that form around like hair follicles. A lot of times they found that it could be associated with like smoking or obesity, but there are still a lot of research and a lot of, investigation as far as treatments and things for this condition, because it's a relapsing, it keeps recurring over time and keeps going away and coming back. And there's no like definitive treatment or like cure for HS at the time. And the people who experience it it can really affect their quality of life. So they're, can be rather debilitated from this condition. So it is one that, very much interests me. And I am actually doing research in this right now to try and aid in finding therapies and treatments and ways to better take care of these patients. So for treatment options, and it includes like medicated washes. You can, cleanse the area with something called like a benzoyl peroxide wash. There's topical or oral medications that you can use. Sometimes they'll give antibiotics or topical antibiotics, something you can rub on the area. There's something called biologic therapy, which is basically it is intended to interact with your immune system and modify your immune system so that it can calm down conditions like this, psoriasis, eczema. And those are just a few examples of what like biologic therapies are used for. And then, of course, wound care, because this is, as you can see, an open wound. And then there's procedures where sometimes they will remove the active skin that has the condition, leave the skin open and allow it to like heal over so that you can remove those bumps and those abscesses and those tunnels. It forms like tunnels under your skin. And you can remove that and try to basically have a fresh start in that area. But that also is like a process that you have to heal from. So, as I discussed, there's no definitive treatment or cure for this condition, but ongoing research is happening to try and make that happen. So, if you know anyone that's experiencing this, I know patients have talked about I've went to a lot of like patient advocacy meetings and things like that for this condition, and a lot of them would say that they would spend 15 years or more, 20 years with this condition, not really knowing that this is what they had. They just said that, their family members, them and their family members just got boils in their skin, not knowing that this was hidradenitis suppurativa, and this was actually a condition that, can be treated by a dermatologist. And so a lot of times, like I said, generally people just go without knowing that that's what this is. And so if you or you know anyone who has something like this, then now you can either guide yourself to a dermatologist or them to a dermatologist to get this treated and help provide some relief. Next slide, please. So vitiligo, I know in this top photo, this is Winnie Harlow, and a lot of people are familiar with the fact that she has vitiligo. It's an autoimmune condition in which the skin loses pigment, causing light or white patches. So basically, the autoimmune condition. The immune system is attacking the cells that make the pigment. You lose pigment over time. So symptoms, you have like white or light patches that spread. Some people have reported that they have itching when the lesions are or the spots are actively spreading, but really it's not painful. It's not like inflamed or irritating. It's just, you can see it's very visible condition, and it, spreads, and it spreads, and it's, not painful or anything. So treatment includes topical medications. You can use some things that calm down the immune system so that it isn't spreading as quickly, and sometimes even allows the skin to repigment and form, to kind of shrink those dark, white patches. You can do something called light therapy, where you literally stand in a box where you receive like some UV light for some time, which is supposed to also calm down the immune system so that these patches can repigment. You can use camouflage products, so makeup and things like that, to try to cover the white spots. And then of course sun protection. We talk about sunscreen a lot. And then can sometimes, like I said, restore the pigment or prevent further color loss. But I've also am very interested in vitiligo as well, and I've gone to some patient advocacy forums for this as well, and they've noticed that some people have tried everything, the topical immune therapy, medications, all the things, and they said that as soon as they stop using them, their skin starts to, of course, the light patches start to spread again, and a lot of them, which I found very empowering, have started to just be very confident in their skin. And of course, as you are a more, have a darker skin tone, those light patches can be much more visible and people can see them more clearly. So it was very empowering to hear those people talk about how they are being more confident in their skin, because this is also one of those conditions where there's no cure, no definitive treatment. And there's ongoing research for this as well that I'm also involved in to help improve treatment and management of patients with vitiligo. Next slide, please. Alrighty, and then there's skin cancer. So while skin cancer is most common in lighter skin tones due to repeated sun exposure over many, many years, you'll see, not only is it more common in lighter skin tones, it's also more common in, the older population, just because it's basically repeated sun exposure since they were young, and not using sunscreen and things like that led to the development of skin cancers. And even sometimes if they use sunscreen, just the repeated sun exposure. So though that is true, people of every skin tone can develop skin cancer. Most commonly, so there's basal cell carcinoma, squamous cell carcinoma, which are the two, and melanoma, which are all commonly caused by repeated sun exposure. But then there's another one called acrolentigenous melanoma. So this is one of the most common skin cancers in people of color, which it's not really caused by sun exposure, because yes, our melanin does help with preventing skin cancers in that way. Still need to wear sunscreen, but it's not really caused by sun exposure, and it occurs in the areas that actually don't receive much sunlight. So as you can see here, It's on this patient's toe where it can occur under the nails like this. And then in the bottom photo, you can see that it's on like basically the bottom of the foot, the sole of the foot. It can also occur like under your fingernails and between the toes. And it is rare, but it is also very aggressive if in the patients that do have this. So I have a picture of Bob Marley here because he actually died from acral lentiginous melanoma at the age of 36. He had it on his big toe. He thought that it was from some soccer accident, and when he went in to get it checked out, they told him that this is what it was and that he needed to get his toe removed, which would have, of course, helped with, you know, limiting or completely removing the progression of the disease if possible. But he, because of his Rastafarian beliefs, he decided to keep his toe, and it resulted in the melanoma spreading to various parts of his body, like his lung and his brain. And he lived about 3 years after diagnosis and passed away from this. So it is, you know, very important to keep your eyes out. I don't really look at, you know, I've been more conscious of looking at, you know, my feet and the bottom of my feet and things like that, because it's in these places that we don't see very often. But it is important to check yourself out in these areas as well, just to be sure. What to look for: new or changing dark spots on the palms, the fingers or the toe webs, under the fingernails, on the soles of your feet. You can look for new or widening dark streak on one of your nails that also spreads onto the skin around the nail. So like the cuticle is not just limited to the nail, because sometimes there are some like benign or, you know, not harmful conditions where some people do get dark lines in their nails. But once it starts to spread onto like the skin, like the cuticle and the skin around the nail, then that is when it becomes more concerning. You can see the nail splitting or lifting or developing a bump underneath. If you notice any of these things, then of course see your dermatologist right away, because early detection does save lives. So yes, next slide, please. I had one more slide about pseudofolliculitis barbae, but I don't think I see it on here. That's okay. I can still talk about it briefly. There won't be any pictures, but basically pseudofolliculitis barbae I felt like was an important condition to talk about because it's very common in Black men. It's not harmful in any way, but it can be very irritating because it happens, it's basically essentially like ingrown hairs in the beard and chin area where tight curly hair can get trapped under the skin from like shaving and things like that. And the treatment is basically with things like that you would use to sometimes treat acne, like retinoids. You can use like benzoyl peroxide washes and other things like that to try and treat the area. But I did feel like mentioning, and then of course the biggest thing for that is to shaving techniques. You don't want to have too close of a shave. You want to cut in the direction of the hair growth to try to limit like pulling and tugging on the skin. And yes, so that is that. So the next thing will be um, skincare and cosmetic therapies. So for skincare, daily skincare, generally you want to have a gentle cleanser, you know, at the end of the day. I use a Cetaphil one. There are a lot of over-the-counter ones that work really well. But then you can also always ask a dermatologist what gentle like skin cleanser will work best for you, depending on your skin type. Then, of course, moisturize. There are, like I said, I mentioned here Cetaphil, CeraVe. There are a lot of really good ones that are over the counter. And then there are also some that are that your dermatologist can recommend to you that you can, you know, purchase either from their clinic or otherwise. And then sunscreen, especially in the morning. Usually you want to go for something that is SPF 50 or higher. And you want to use a mineral sunscreen. So I put in quotations here zinc oxide, because that is usually the ingredient in a mineral sunscreen that you want to look for. A lot of the time, mineral sunscreens can cause a white cast on your skin, especially if you have browner skin tones. So going for like a tinted sunscreen is the best option. if you can find one that works really well. I use one called Elta MD, and it's not tinted, and it is a mineral sunscreen. And I feel like if I moisturize my skin very well and kind of lay it on top and let it sit on my skin for a while, I've noticed that that white cast kind of almost like dissolves and melts into my skin. So I really like that one. But it can be like on the pricier side, and some of these sunscreens can be, but it just sometimes it takes trial and error to find which tinted mineral sunscreen works for you. You also most recommend that you apply sunscreen, especially if you're sitting out in the sun and like during the hottest hours of the day, every 2 hours is the best practice. And then of course you want to, if you're out in the when the sun is at its hottest point and at its highest point, you want to wear other types of physical barriers like hats and things like that, and make sure that you're protecting your skin that way, because wearing sunscreen helps with anti-aging. It helps, like I said, with those dark spots to help lighten them up. So not only with skin cancer, if skin cancer is not as much of a concern as far as getting skin cancer from, repeated sun exposure, there are other things that we can prevent with sunscreen. So yes, there's something called like seborrheic keratoses that sometimes can happen with older age, but also can occur and be worsened with sun exposure. So there are lots of things that sunscreen helps with, and it just smooths out your skin and keeps it looking young and fresh. So sunscreen, sunscreen, sunscreen. And then for some anti-aging, you can use retinoids at night. A lot of the times those retinoids are prescribed by like dermatologists, so tretinoin, things like that. But then you have like retinols that you can get over the counter. I think Dr. Robinson can talk a little more about those. I'm pretty sure retinoids are a bit stronger and more potent. But yes, and it also works for bumps and any like acne on your face as well. Sunscreen, again, is important for anti-aging. And then vitamin C can help brighten the skin. You have hyaluronic acid, which can provide like moisture to the skin that gets drier, and it's harder to keep moisturized as you age. So lots of moisture, lots of plumping. It can provide a little bit of like plumping to the skin as well, through keeping the skin very hydrated. And then for cosmetic considerations, I'm just talking briefly and in general here. This can all be tailored once you see like a dermatologist and you have them evaluate you and like have a consultation. They can kind of tailor these procedures to what your personal needs are. So for fine lines and wrinkles, people go for Botox, especially, if you want to prevent new wrinkles from coming. Botox can kind of, talking to a very experienced dermatologist once, and he said that there is some type of like the Botox can smooth out some of the finer lines as well, but it really causes, your skin to not scrunch up so much and kind of paralyzes some of those muscles so that you doesn't squish your skin up basically and cause wrinkles to form in that area. And then there's fillers. So if you have very deep wrinkles in certain areas of your face, you can get those filled in with fillers. And then there's laser too. As far as darker skin, there are a lot of considerations when it comes to laser. So you want to make sure that you're choosing, why, a lot of dermatologists are very experienced with using which laser for what skin type. But of course, you want to make sure that that is something that you keep in mind as well as far as getting laser. And then there's hyperpigmentation. Treatment for that would be like chemical peels. I don't know if you've all have heard of that, but it basically they apply a product on your face. They let it, you go home with it on your face, and it slowly peels like the top layer of your skin, so that it can remove that layer, and then it reveals a fresh new layer of skin. And there's a whole process with that. And then there's laser for hyperpigmentation as well. You can get laser on like, dark circles and other things like that. And then for hair loss, there's something called PRP, which is like platelet rich plasma. So basically, it's interesting. Actually, they take a little bit of your blood, spin it down, take the platelets and inject it into your scalp to try to have hair regrowth. I saw this back when I worked at a derm clinic in 2019. I don't know how common it is anymore. I haven't seen it in more recent times. I know that it still is a thing, but yeah, so that's an option. And then, of course, injecting like steroid and things into your scalp to try to promote hair growth and reduce inflammation. It's not really a cosmetic procedure, but I put it under here because it is something that you can choose to do or not to do sometimes, depending on the type of hair loss you have. And yes, so that is that. Next slide, please. Okay, so generally, some takeaways that I want everyone to have from this presentation is that skin conditions can present differently in darker skin tones compared to lighter skin tones, with some conditions affecting people of color more frequently. Some that I named, like the pseudofolliculitis barbae and the acrolentigenous melanoma. Diagnosis, treatment, and management by a licensed dermatologist is vital for proper skin health and, in some cases, can save your life, as far as that melanoma I was talking about. So, yes, next slide, please. So, here are some resources. Generally, I talked about the American Academy of Dermatology Association, that you can go on their website and they have some explanations of skin conditions on there too. They have resources to finding dermatologists and lots of things for people to kind of get some more information about dermatology and skin conditions. The HS Foundation is Hidradenitis Suppurativa Foundation. It is a foundation that is also advancing research and also a community for people with HS to come and talk to others with HS, because as I stated, it's a condition that is chronic for the people who have it and very debilitating. So they have communities where they can talk about their experiences, which a lot of them have found it really helps. The Global Vitiligo Foundation is similar to HS Foundation, with a lot of research going on in terms of vitiligo and also patient advocacy and support. And then a Society for Pediatric Derm, and then there's many, many more. So all of these foundations and associations that I named, they all have resources too for patients who are and people who are just looking to learn more about it, especially if it's something that you're experiencing. So yes, that is that. Next slide, please. So yes, thank you everybody. That is my presentation, and we will be taking any questions.
Awesome. I'm going to add Dr. Robinson to the screen. I'm going to pop off. We do have some in the chat, and so I'll put them at the bottom of the screen. They'll be scrolling.
Okay.
Okay, so this question says, my big toe color has changed. My skin is brown. My toe is white. I was told by my PCP it comes with age. So it depends. Melanoma is definitely on the differential of things that can cause pigmentary changes in toenails. So I would definitely seek evaluation from a board certified dermatologist to make sure that it is nothing that is harmful to you. You can also get just longitudinal melanonychia that can be caused by trauma. It can be genetic or run in families, and it is more common in people of color. But to be able to differentiate from the two, a dermatologist would need to evaluate that.
Does age result?
Age typically doesn't result in skin darkening, aging in and of itself. Cumulative sun exposure over time can cause skin darkening. Lots of things, medications can oftentimes do it. Dehydration of the skin can make it appear more dark and dull. So I would kind of take a deep dive and see which of those things may be causing your skin to darken over time.
So there's, from what I understand, there's not a definitive cause of vitiligo. Is that correct? Yes. So there is investigation that says there may be a hereditary component, but there's also their investigation of saying, like, what is the main cause of vitiligo. A lot of the time there's still hasn't been like a definitive thing that says yes, this is the, the result of, this is what causes vitiligo. So while it being hereditary is something that is being considered, It's not definitive at this time.
So I'm going to go back to the vitiligo question for just a moment. And I'm sorry, I didn't introduce myself. I'm Dr. Robinson. I'm a board certified dermatologist. I practice in Florida. Sorry, my audio was being wonky, so I was trying to fix the audio. And Dr. McKinney introduced me at the beginning, but I know some people may have joined since then. So vitiligo is a multifactorial disease, or a lot of different factors that contribute to vitiligo. So there's definitely a hereditary component. There's a lot of genes involved. So there's a genetic component, and also your immune system. So essentially, your immune system has cells that attack the pigment producing cells, or the melanocytes, which cause them to lose pigment or have those patches of white skin. So it's multifactorial, but hereditary or genetics definitely plays a role. Good question. Lots of things can cause dark circles under the eyes. So you can have volume loss, which is common. It happens over time. So you can have hollowing under the eyes, which makes them appear darker. You can have increased vasculature there. So you can have a lot of veins underneath the eyes. So that has a blue hue or tint to it. So that can make it appear dark there. Genetic things, some people really do have just pigments or hyperpigmentation or dark spots there. And then another thing that can cause is allergies or sinuses. So there's a lot of things that may cause it, and the treatment of those is different depending on the type. Going to be evaluated by a dermatologist is helpful because they'll be able to say, okay, what is causing you to have dark circles under the eyes, and what can we do to properly treat it? You guys have some good questions. So I will say stretch marks and cellulite are hard. I think it's first important to note that they are normal. Like, most people have these things, and they are not dangerous at all. Sometimes laser can be helpful, but all of the creams that you see probably on Facebook and ads on Instagram and such are not going to be very helpful. So do not waste your time and your money on them. So yes, Dr. McKinney talked about this a little bit. There's lots of different products that are available for hyperpigmentation. There are over-the-counter products, glycolic acid, lactic acid. Those kind of help to exfoliate the skin. Retinol or retinol, those are also available over the counter. Kind of the gold standard is a prescription strength bleaching cream called hydroquinone, that can be prescribed by your dermatologist. I will say the most important thing when you're treating hyperpigmentation is to make sure you're wearing sunscreen every single day. For my patients of color, I do recommend a tinted sunscreen, like Dr. McKinney mentioned, that offers visible light protection, and visible light has been shown to make dark marks or hyperpigmentation darker. Another good over-the-counter option for hyperpigmentation is Eucerin as a brand, but they have a Radiant Tone line, which has an ingredient in it called thiamidol. And it's a very good anti-pigment agent, and it can be found in lots of different formulations. They have a body cream, they have a night serum, they have a day cream with sunscreen in it, they have a night cream, they have an eye cream. So lots of different options there. So if you're looking for an over-the-counter option, that is definitely something that you can add to your regimen.
Well, so a lot of the time, like we were talking about, there are something called tretinoin that can be prescribed. There's something called like benzoyl peroxide wash, so a cleanser that can be prescribed to you, um, or whoever you're talking about, the teenager, to kind of kill some of that bacteria that's in the area. Sometimes they'll give a topical antibiotic as well. So it really depends on the severity of the acne too, because if there's something called cystic acne, then there is something that called, like, they'll give you a oral antibiotic, so something that you take, like a pill called doxycycline, or something similar like minocycline, to kind of kill some of the bacteria in the that can be causing the acne or the cystic acne as well. So it is really tailored to the patient, but those are some options to give that you can be prescribed. As far as over the counter, I mean, they're mostly like cleansers, right? Or no? I know don't know exfoliants as far as like the little beads, the stained eyes, and things like that. Avoid those. But
Yes, those can definitely be irritating. There are a lot of over-the-counter treatment options available. Benzoyl peroxide is a great ingredient and comes in many different strengths from like 2.5% all the way up to 10. You can buy it as a gel or a cream that you can use all over the affected areas. It also comes in many different cleansers. Lots of different brands have it. Salicylic acid is also a good ingredient for acne, blackheads, whiteheads, for your prescription things, clindamycin, oral medications, pills. We, of course, would need to see. Oftentimes, primary care providers will get the patient started, and then dermatologists will kind of take over the care, as it can take a little bit longer to get in to see a specialist. But there's lots of things we can do to treat acne. I will say for my acne patients, it is very important to treat the acne early. It's easier to treat acne than it is scarring. And a lot of times, patients, especially my patients of color, are more bothered by the post inflammatory hyperpigmentation or the dark spots left behind from the acne. So, the sooner we can get a good control on the acne, the less dark spots we will have. And then we can start focusing on treatments tailored specifically to the dark spots. Also, pimple patches are helpful, especially for a lot of people, teenagers, adults will pick their acne. So, a pimple patch, if you put it on there, it'll help heal the acne bump, but it'll also be a barrier. So, you're not picking or touching your skin.
I live by those. And the hero, the invisible plus ones in the blue pack, they blend straight into your skin. Some of the teenagers like the little stars and stuff,
Yes,
so they want you to see
absolutely.
their. But I'm a little bit too old for that, so I like the invisible one. It blends right in.
Me too. Me too. Lots of different variety and options there.
Mhm. So, what over the counter brand do you recommend for daily use or daily regimens? So, for me, for different people, it could be a little bit, different. It sometimes takes trial and error. For me, I like Cetaphil. I used Cetaphil, CeraVe, for cleansers and moisturizers. Cetaphil works a little bit better for me personally. I noticed that even though they both say they don't really cause like acne bumps, for some reason I've noticed with CeraVe it just kind of sits on my skin in a weird way, and my acne acts really funny. So it depends. It's from person to person. Some people say Cetaphil cleansers can dry their skin. So I do recommend those two, though. I know that I've seen that a lot recommended by a dermatologist that I've worked with as well. Um, there are some like Aveeno is also good, and trying to think. There's one more that I'm trying to think of off the top of my head. Oh, La Roche Posay is also a really good one that I see recommended by dermatologists a lot as well. It has a lot of really good sunscreen, really good moisturizers, and cleansers as well. So yeah, these new products on the state. Oh, I
Don't
don't think
do
I.
it. I have not seen these products, but I will say don't do it. If you want to have moles or like DPNs or the Morgan Freeman spots, they're often they referred to removed. Go to a dermatologist first and foremost so they can be evaluated, right? You don't want to
Right,
remove something at home that may be harmful to you, and you remove it at home
right.
and throw it in the trash and have no idea what you just removed. So first you can be evaluated, and said, okay, this is something benign, we can remove these, or this is something that we actually need to biopsy and sample. And then when you go to your provider, you're making sure the area is clean properly, it's sterile, you know, the potential risks and benefits that are associated with it. And it can be done in a way that is most beneficial to you and to reduce the risk of scarring or dyspigmentation. So I would not um, buy any of those. I would go see a board certified dermatologist.
Well, we've got some great questions coming, huh?
Yeah, yeah.
Absolutely.
I love.
So I have one more and then we're going to conclude. Someone sent me this. What causes hair thinning and hair loss in women and men?
There are a few different things that can cause hair thinning and hair loss. One of them that I didn't mention is it's called androgenetic alopecia. So that's like your male and female pattern hair loss, where with aging, you just start to have that hair thinning. You know, a lot of the time with men, they call it the receding hairline. I think my video is frozen. I'm trying to get it to not freeze. But yes, so that's one example. I gave two other examples too, where there's like non-scarring, where sometimes like your immune system can start to like attack your hair cells, and then you have like this area of balding that a lot of the time grows back. It's called the alopecia areata. And then there's scarring alopecia, or alopecia caused by like inflammation in your scalp, where the one that I named with the CCCA, it causes that like inflammation, tenderness, itching in the center of your scalp, and it spreads from the crown of your head down. Where it's caused by inflammation, so you can catch that one kind of early with like injections of steroids, and like seeing a dermatologist, of course, for those two to kind of try to slow down the spread of that one. And there are many more too. The traction alopecia, like I said, with the braids and like the tight hairstyles, and yeah, things like that. There are lots of causes.
Awesome. Well, thank you. So the questions that we posed on the screen, they're saying thank you, thank you, thank you. This is important. Excellent job, ladies. This is good information. Thank you to both of the doctors. So just so you know, the information was well received. And so we'll have to look into having you both back. So yeah, thank you, Dr. Robinson. I'm not sure what's going on with Dr. McKinney's camera right now, but I'm going to take you guys and put you in the green room, and then I'm going to end the session, and then I'll say goodbye before I leave. Okay?
Thank you all so much for having me.
Thanks, everybody.
So you all did an amazing job. Thank you for showing up for that impactful session. We'll have to do more. Dr. McKinney and Dr. Robinson were both so amazing. So I want to say thank you again publicly to them. Thank you for putting your questions in the chat. And we're so grateful that we were able to give you the good information. Bishop or Charles is on. Charles Ellis said, excellent, and thank you for sharing your expertise. So we are so grateful. Leslie is saying, great presentation, good information. So yeah, thank you, ladies. On behalf of Buddy or Charles Ellis, he actually made the introduction for Dr. McKinney and I to connect, and we look forward to bringing her back to this platform again. So without further ado, the month of August, we have our Back to School Festival. It's August the 11th. We want you to like and share. Those of you that have been, you know it's an amazing time. We're going to be giving away backpacks, and we're still accepting a backpack. So if you get a backpack, you can drop it off at the main information desk, and we will store it appropriately. Our goal is 200. And so we're a little bit shy of that. So we're asking that you purchase one backpack. And that's all we're asking per family. You drop it off at the church, and we should have an abundance to pass out on August the 11th at our Back to School Festival. So we look forward to all of you that are excited and want to participate with us in that. And then on August the 30th, we have a diabetes awareness event, and we're asking that you go ahead and get registered. That's going to take place immediately following morning service. And so that's going to conclude the announcements on today. I'm so grateful to Dr. McKinney, Dr. Robinson, and for all of you that took the time to join us on today. If God says the same thing, we'll bring more information like this to you next month. God bless you all. And again, thank our wonderful bishop. We cannot conclude without thanking him, because he affords us the opportunity to be here on this platform. So know that I love my pastor, and I'm so grateful for the trust he has in us that allows us to come to platforms like this and to give you impactful information. So God bless you. If the Lord says the same, we'll see you again next month on a Thursday with more impactful information. Take care.